Often hailed as the first responders, 911 dispatchers help save lives, and sometimes at the cost of their own mental health. There is a local program, though, working to help with that. Shelly Castellano is a dispatcher in St. Johns County who's joining us this morning. Good morning. Thanks for being with us.
Good morning.
Of course, this week is National Public Safety Telecommunicators Week, so this is highlighting, what is a 365-day-a-year profession, right? That you hold as a dispatcher. Would you share a little bit your role, within the Sheriff's Office, St. Johns County, for our viewers who only really meet you on their worst day?
Right.
Really,
yeah,
if you think about it.
Right. So we're the support function of law enforcement and fire rescue. And at St. Johns County Sheriff's Office, we answer well over 500 calls in a 12-hour shift, as well as dispatching those calls out. So throughout the whole day, we're talking to people on a bad day or their worst day. So they just want us to be their advice giver, ear to hear, or even that lifeline when those seconds count, like CPR being instructed or the birth of a baby. So it's truly a roller coaster of emotions, but where they're calm in their storm.
How do you stay calm? I mean, how do you even prepare for that call?
Yeah, it's one of those things where you're in the moment and you know that they're relying on you and you can't let them down. So you have to be that rock for them.
Or panic, is the CPR instruction, for example, or delivering a baby, that you have a role in helping with that until the other first responders can get there, right? So you've got to walk them through that. Absolutely.
And so to be calm is the best thing for them. You don't want to panic, because then they'll panic more because they're already upset. Yeah.
And at the end of your shift, I mean, how do you just disengage with that and it's not always there, particularly those calls that don't end the way that you want them to?
Exactly. It's very heavy and it does build sometimes, so it's tough. But you have to just try to know that the best we did, and there was nothing more if we don't get the outcome.
I want to talk about the mental health component of this, and part of this is also, I think, for our viewer to have a better understanding of what you do experience on a day-to-day basis.
Yeah.
Would you share, some of the most difficult, calls that you get? You were mentioning maybe, CPR and...
Right. So we get all sorts of calls throughout the day, but some that are the heavier ones are just like CPR on babies or children that are found that are drowned. And so the room kind of gets quiet and we're listening and we're holding on waiting. So we're feeling that too, waiting to hear that first breath,
And sadly, sometimes that doesn't come.
Sadly, it doesn't.
So how do you, the mental toll that it takes on you and the others that you work with,
right?
How do you navigate that?
So originally it's a thing where first responders don't like to reach out and talk when something's bothering them, for fear of ridicule or judgment. They can't handle the job or whatever. So it's important to be able to reach out. And at St. Johns County Sheriff's Office, we have either chaplains or we have our great peer support team that we've created that I'm an active member of. And so we're available all the time and it's confidential. Sometimes though, they don't want to reach out. However, LSF Health extends a free resource to 20 counties that you can connect privately to a current or former first responder or a military member, and that's also extended out to their family members as well. Because family members can feel when you come home and you've had that heavy wear or tear, so at least the family now can have somebody to reach out to as well.
So because obviously there's something in place for St. Johns County. I mean,
yes.
With how you're helping also connect people with others,
yep.
And also LSF. But for those who are watching who are dispatchers, let's say not in St. Johns County, can you what should they do? They're ambivalent about asking for help, but I think that what is so wonderful about what LSF, it sounds like, is offering here is an opportunity to connect with someone else who's in the same position as you are.
They are, yeah, because not every agency has a peer support group. So that is what's so special about LSF Health. And you can reach out to them by dialing 211, or you can go to stayfitforduty.org and reach out to them. And it's all confidential, it's free, that stays with them, and you can feel like you can reach out to them during your time of need.
How has peer, this program and LSF, how has that helped you?
It's helped in a very profound way, because you feel that you have someone to turn to and that you're not alone. that there's people that understand what you're going through, and they're going to be there for you even at your lowest.
You've been doing this for 6 years. What
ma'am.
drew you to the profession?
My mom, she said, I believe in you, and I didn't even believe in myself, and she said, just go for it, you can do it.
And how do you feel about the work?
Oh, I absolutely love it. It's really given me a different perspective on how you can make change and take it and make the best of it.
Oh, thank you for you. Thank you for all of you. We appreciate you. I mean, we've all been in that situation where something has happened and you've had to call 911, and these are the people who are answering that phone, and we appreciate you every day. We sure do. Thank you, Shelley, for sharing your story and for the information about LSF. If you'd like more information, just search LSF. Is there a website that they can go to?
Yes, it's stayfitforduty.org or dial 211.
Okay, easy, 211.
Yeah.
Thanks again for being here. We
Thank
appreciate you. We'll be right back.